You will remember when the COVID crisis really took a grip and Boris Johnson started locking us down, and we basically went through a couple of years of hell, that many people are questioning now. Many people feel were just not necessary. And guess what? It seems that back in March 2020, for 48 hours, the United Kingdom authorities, in other words, Boris Johnson's Tory government, had a plan. They said, oh, there's no plan. The COVID inquiry says, no plan, that's a problem, chaos. Well, we just plunged into this. Apparently, we did have a plan. And that was to manage the pandemic in much the same way as Sweden. The British people were going to be trusted to be sensible. They were not going to be locked down. They were not going to be forced to wear masks. Now, with the benefit of hindsight, it seems to me that was the way to go. But we didn't. Boris and his acolytes bottled it, frankly. Now, let's talk to Professor of Evidence-Based Medicine at the University of Oxford, Carl Heneghan. Good morning, Carl.
Good morning, Kevin.
I mean, this is what happened. This was according to Professor Robert Dingwall, who said, you know, the narrative surrounding the COVID inquiry is that we sort of stumbled into the COVID crisis. We had no plan. It was all a shambles. But according to Robert Dingwall and other people I've spoken to, we did have a plan. We just bottled it. For 48 hours, we were not going to lock down. We were not going to think about mandatory masks, social distancing, anything like that. We were going to do what Sweden did. We were going to trust the British people to be sensible. Instead, they bottled it, and the rest is rather sad history. This is depressing to learn this.
Well, Robert Dingwall, somebody I would trust, is a man of great experience who, to put it mildly, has been round the block and has been in the room when many of these decisions and preparation were being made. So when he speaks from a position of authority and experience. What he's saying is exactly what you say. We did have a plan. We looked at all of the scenarios, like don't close schools, actually let's keep society open. But you're right, we had this alternative narrative. Remember, we had 2 weeks to flatten the curve, the hammer and the dance.
That's right.
We had people like Piers Morgan coming online screaming that we need to shut down. But we had people like Patrick Vallance at the beginning talking about herd immunity, a word that became sort of something you couldn't go to within a few weeks. Now, what changed it all was the Imperial Report 9, led by Neil Ferguson. Here we go, it's going to be 500,000 deaths. And suddenly we threw the plans out the window, and suddenly we're completely locked down. And then it was being made up, as you look at it, on the hoof. Dingwall points out 3 points. He say basically our politicians weren't up for the job. It's almost like now across the board they don't have the gravity to be able to sit back, be cool, calm and make important decisions. The second thing is, he said a lot of advisors disliked the government coming out of Brexit, but also were paternalistic in the approach. They knew what the right thing to do. And then the third issue he points out is the good old financial gains that were made by huge numbers of people. Some people profited huge amounts in the pandemic, and it was good for business. So I think there are wise words in this article that are worth reading.
Indeed. What concerns me now, Carl, is I was listening to Jenny Harris yesterday, one of our chief medical officers. I'm not sure what she is right now, but of course all of the medical advisors to the government were all honoured for their fantastic work. Some of us feel that their work wasn't that fantastic, but they're all made dames and sirs and God knows what. That's how you build up a picture of success, as if our COVID efforts were a great triumph. Well, I don't think they were. Now, Carl, she was talking, and others are saying, now what we're now developing vaccines for, preparing for, is disease X. We go, OK, that sounds terrible. What is it? Well, it doesn't exist yet. But it might come along and then we'll have another pandemic. Why do these people indulge in such, in my view, irresponsible scaremongering?
Well, I think you're right here. So she's of the UKHSA. She's chief of the body that replaced Public Health England. I think what's happening here is in society, over here there's a distraction technique that's saying we've got disease X, and over here we've got huge mounting problems in healthcare that we're not addressing. Just as we go into the winter again, have we sorted our emergency care? Have we got enough beds? Are we available? So I think one is distraction. Second is to make you forget about the lockdown. We're moving on. It's in the past. But actually, last week there was a report. I think we don't quite get the devastating consequences of lockdown and restrictions. So the number of child deaths involving abuse or neglect rose by 35 to 223 in 2020-21. So we had lockdown and restrictions, and we made child abuse and neglect easier to do, if you like. And now we're seeing the consequences of that, and we're ignoring it. And we're talking about disease X and moving on when we should be looking at the catastrophic consequences, as you say, of the decisions we made, but also many of the failings in our health service where we need to get them sorted, and we don't seem to be able to get onto top of anything. So as we sit here, there's still 7 million people waiting in the health service, and we're talking about disease X. I find it quite something that actually these people actually don't understand half the time what clinical medicine is about.
Absolutely. Now, I should sort of preface this question with the fact that many medical experts believe that lockdowns work. Many politicians believe that they work. My contention was during the COVID crisis, if you have a lockdown, for our first one was a couple of months, wasn't it, or maybe more, and then you come out of that lockdown, and then 2 months later you have to impose another lockdown, that proves that the first one didn't work. And I think we did it, was it 3 times? Do you think lockdowns work?
So I think you're right. The first one lasted 4 months. It wasn't 2 weeks to flatten the curve. It was 4 months. And then some areas stayed in permanent lockdown, if you remember. Places like Oldham and Leicester never came out of lockdown. So I think you're right. You have a natural experiment that says we tried lockdowns. They didn't work the first time, didn't work the second time. The most important issue as well is where they didn't work. They didn't work in care homes. They didn't solve the hospital-acquired infection problem. In fact, you could argue they made it worse. And at times, 40% of people were catching the infection in hospital, the most vulnerable, those most likely to die from the disease. So there were many areas that didn't make a difference. I think if we look at it in the round, the experiment's been trialed, and actually the failings are so bad, the medium to long term, but the short term, even in the pandemic, it didn't make a difference. The problem here is we have a very short-term memory. If you look at it now, Matt Hancock's moved on. He's gone to TikTok. Boris has moved on to his swimming pool and talking about his newts. Many of the people will be turned over, and this institutional knowledge will be lost. And the problem is 5-10 years down the road, we'll be talking about the next virus and the next pressures to lock down for the very same reason. Poor politicians, people with sort of an agenda and ideology about supporting lockdown. And there's a lot of money. We spent nearly 40 billion on test and trace. There's a lot of money to be made in a pandemic, and many people did benefit.
Well said, Carl. Great to speak to you. Thank you very much for your time. That's Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford.